Introductory Mental Health Nursing, Chapter 4, Treatment of Mental Illness. This PowerPoint comes from the textbook by Cynthia Chinchillo. We're going to get into Chapter 4, Treatment of Mental Illness. So we've been discussing mental health, mental illness, and the different types of mental illness. So how do we treat these patients? Well, we want to establish what's called a therapeutic milieu. And this is a safe, secure, structured environment. And in this environment, the nurse forms a therapeutic relationship with the patients. This is a safe environment that is a bit different from a normal hospital kind of setting. There are minimal items in the rooms, only pretty much a mattress. Even the sinks are covered, the piping is covered, there's no strings for call bells. So it's really a different kind of environment. And that environment is called the milieu. When we are in the milieu, we seek to establish a therapeutic relationship with the patients. We want the patients to know that we are there to support them. And there's certain topics that we want to cover with our patients. Those topics, when they first come into the milieu, are talking about things like the times of visitation. When will family be able to visit? Also, the different times for therapy sessions. In the milieu, there may be individual therapy, there may be group sessions. So we'll let the patient know all about those things. Also, when will they have personal free time? We need to let the patients know when breakfast, lunch, and dinner will be. When do they have snacks? Is smoking allowed? Now, in Hampton Roads, all the hospitals and medical facilities are non-smoking. The entire campus, the hospital area is non-smoking. So will they be able to have caffeine? That's going to depend. And many times we don't give caffeine to our patients in the mental health setting. We'll let them know what food will be available, if snacks, if any. We will not have them have any sharp items. So when it's mealtime, they will not actually get real silverware. They will only be allowed plastic flatware. A lot of times they may only get a spoon or maybe a spork. So we don't want them to have anything that could be used potentially as a weapon. We also will cover with them their medication schedule, letting them know what medications they're taking and what time they will take those medications. We also will let the patient know what activities will be taking place. So sometimes they may have games like bingo or board games or puzzles. So we want to let the patients know what to expect. Let them know about telephone privileges. So there are telephones in the milieu and they're taken out for a certain period of time so the clients may use them. We also want to let them know about the restricted areas. They're not allowed in the nurse's station. So things like that are really important to discuss with your patient, especially as they may be new to the unit. And again, we want to establish a therapeutic milieu, which is a safe and structured environment that facilitates the therapeutic interaction between the patients and the members of the professional team. Now, the team consists of social workers, nurses, therapists, psychiatrists. So it is an amazing team that collaborates to work with these patients. The role of the nurse is to maintain dignity and acceptance within the milieu. And the nurse should be a role model for behaviors. The nurses should be following the rules and setting the rules and maintaining the boundaries. Those are going to be really important concepts. The nurse is responsible for maintaining the safety of the patients and of the staff. And again, following the rules, maintaining those boundaries, being Firm, fair, and consistent is the way to go, especially in a mental health kind of setting. We want to make sure that we get those boundaries and we stick with those boundaries. We want to avoid escalation, so we'll use calm voice. We will de-escalate. We will discourage physical violence or foul language. We will address those issues as they come up immediately. And we want to provide interventions that facilitate any maladaptive behavior. So we want to be able to modify that maladaptive behavior. And so maladaptive behavior are those negative ways to cope. So if a patient becomes frustrated, no, they can't punch the wall. But what they can do is sit down, take 5 cleansing breaths. That's something that's more appropriate. So we want to teach the patients those coping skills that they will need. We want to also make sure that the patient knows that there is an interdisciplinary treatment team. And that team consists of members like the psychiatrist, a clinical psychologist, a registered nurse, the LPN, a mental health technician, social worker, a licensed professional counselor, care managers, outreach workers, therapeutic recreation specialists, occupational therapists, and even a religious advisor. So there's a lot of folks that are a part of this interdisciplinary treatment team, and they all work together to help to establish a therapeutic milieu and to make sure the patient has all the resources that they need in order to recover. So you may be wondering, okay, what is the role of the nurse? So that's really important. So the nurse has many different roles in this therapeutic milieu, and the 4 main areas would be caregiver, counselor, educator, and advocate. So when we are the caregiver, we give foundations for implementation of all the nursing interventions. We will use the nursing process and we will collect data on the patient. We'll make observations of appropriate and inappropriate behaviors. We will also look at what are some of the precipitating factors. What are some of the triggers? What are some things that can be reinforced? The nurse also will provide a response to the therapy, right, while performing other nursing interventions. So we will observe the patient as they're taking their medication. Do they seem to be cooperating? Do they seem to understand? Are they still in an escalated state of mind? Like, for example, if the patient is in a manic phase. So we really have to have our senses and our wits about us. Our nursing assessment skills must be fully turned on as we are caring for the patients. We also serve as a counselor. So caregiver, counselor, educator, and advocate. So talked about being a caregiver. Let's talk about a counselor. A lot of times the nurse will encourage the patient to openly express feelings and thoughts without fear of judgment. So we will be that listening ear. Now, not all behavior is acceptable. If there is inappropriate behavior, something maybe that is sexually suggestive, something that is outside the bounds of professionalism, the nurse must immediately address those concerns and those behaviors. But at the same time, we must let the patient know that we do still care for them, but we don't care for those behaviors. So we have to separate the behavior from the patient. So unconditional acceptance of the patient as a person is imperative for the therapeutic outcome. We think of the nurse now as an educator. Again, caregiver, counselor, educator. So as an educator, we are the link between the patients to learn about their illness, their treatment. And it's really important for us to do a good job educating the patient so they understand what their condition is and what their treatment plan is. So the nurse should also be able to determine, does the patient understand what is being explained? Does the patient understand what their treatment plan is and how to follow it. Okay, so caregiver, counselor, educator, lastly, advocate. So we have to help protect the client's rights, and we have to accept them and support the decisions that they make. We also want to help them adhere to their treatment regimen, and that's going to help, we can help them by being empathetic and non-judgmental. We should be willing to listen and understand how the problem can be viewed through the patient's eyes, really. So we're going to utilize empathy. So let's talk about the different types of therapy. There is psychotherapy, which is a dialogue between a mental health practitioner and the patient with the goal of reducing the symptoms of the emotional disturbance or disorder and improving the individual's personal and social well-being. So the aim of this dialogue is not to give advice, but to allow clients to learn about themselves, their lives, their feelings, and to make choices towards change. The intent is for the patients to rediscover their identities, their priorities, and inner courage to act on these priorities. Credible psychotherapy fosters insight into feelings, behavior, and interpersonal skills with success, resting in the quality, not the type of therapy used. Most clinical licensed mental health practitioners embrace an eclectic approach, meaning that they believe in using components of many types of therapies in their practice. And the great thing is that they're able to flex depending on the needs of the patient. So they have to be very flexible. So there is individual psychotherapy, and that is working with the patient one-on-one. There's also psychodynamic therapy, and that's based on psychoanalytic theory, or the assumption that when a client has insight into early relationships and experiences as a source of their problems, the problems can be resolved. So this is a Freudian-based therapy that lasts several years with biweekly sessions. So again, we're looking at possible childhood trauma as a cause of their issues, and we have to uncover those issues. So let's talk about humanistic therapy. This centers on the client's view of the world and their problems. The goal is to help the clients realize their full potential through the therapist's genuineness, unconditional positive regard, and the empathetic understanding of the client's point of view, which fosters the client's sense of self-worth, their humanity, right? That makes sense. Humanistic view. Behavioral therapy does not foster awareness, but emphasizes the principles of learning with positive or negative reinforcement and observational modeling. The goal of behavioral therapy is to bring about behavioral change within a relatively short period of time. In this therapy, the behavior or symptoms is the problem. The underlying belief is that the original causes of maladaptive behavior may have little to do with the present factors invoking this behavior. The next thing that we have to look at is cognitive behavioral therapy. This is based on cognitive. When we think cognitive, we need to think about thinking. So this cognitive behavioral therapy is based on the cognitive model that focuses on identifying and correcting distorted thinking patterns that can lead to emotional distress and problem behaviors. Really important. Contracting. Contracting is a behavioral technique in which the client and the therapist draw up a contract to which both parties are obligated. The contract requires the client to demonstrate specific behaviors that are included in the therapy and also defines what the therapist is responsible for doing. The criteria for success are clearly outlined in the contract. It is important that reinforcement, schedules, times, limits, and consequences be consistently followed. This is really something that is especially important in mental health. I know we've discussed this before, but we must follow the rules, the policies, the procedures. We must establish clear boundaries. There should not be any gray area, and all of the staff must be fair, firm, and consistent with respect to these policies and how we treat the patients. Because in a mental health setting, these patients are very manipulative and they learn how to work the system. So maintaining those boundaries, establishing the boundaries, and following the rules are going to be very, very important. All right, so telehealth is something else that we need to mention, and that is the use of electronic and telecommunication technology interact with patients. In mental health, there is growing research that suggests this type of therapy may be more successful, especially with children and adolescents, than traditional face-to-face intervention. When telehealth is determined to be a desired approach, an initial in-person visit should occur that consists of identification of the individual, a face-to-face intake history, and a head-to-toe assessment. This initial interaction is usually done by a psychologist or other healthcare provider. Once the client is established, video messages via a phone or computer camera where both the patient and the mental health care provider can view each other can be used to monitor progress towards the goals and review medication effectiveness. Okay, so let's now talk about group therapy. In group therapy, a trained therapist leads a small group of people with similar problems who discuss individual and common issues. Remedial groups are concerned with individuals who are not coping effectively with the stresses and strains of living. These groups can assist individuals in learning age-appropriate ways to manage behavior or regain self-control. They also need to learn skills for conflict resolution here in the group setting, problem solving, and interpersonal socialization, as well as communications. The groups often work through negative content before positive results can surface. Couples therapy is the next topic, and it's highly effective group model and is used to help couples resolve interpersonal conflict and and initiate enhanced communication skills. In cases of marital conflict, the therapy tends to be most effective if the differences are of short-term duration. The therapist facilitates by listening to points of view and reality expressed by both partners. Let's take a look at family therapy. Family therapy involves discussions and sessions designed to assist members with problem-solving skills within the family system. The problem may lie with all family members. Troubled communication amongst family members, or center the behavior on one particular person. So with family therapy, the underlying belief is that the individual problems originate from the family system. To treat the basic issue, the whole family must undergo therapy. The goal is to facilitate and encourage the family to work together, listen to, and respect each other as they gain an understanding of how their behaviors affect the entire family. Okay, now let's take a look at electroconvulsive therapy. So this is treatment using a low voltage electric shock wave that is passed through the brain to induce short periods of seizure activity. So yes, let me say that again. Electroconvulsive therapy is a treatment that uses low voltage electric shock waves passed through the brain to induce short periods of seizure activity. The seizures themselves appear to aid in restoring a chemical balance within the brain. This serves to help relieve the serious symptoms of mental illness. Some conditions where this type of therapy may be used include severe, major, treatment-resistant depression, psychosis, bipolar disorder, catatonia, severe agitation and aggression in dementia, and severe suicidal ideation. Electroconvulsive therapy, that's also known as ECT, is generally reserved for clients with severe mental illness that are unresponsive to medications and other forms of therapeutic intervention. So this is usually the last resort. The role of the nurse is to make sure that the patient stays safe. We'll take a set of vital signs before the patient goes down for their ECT. And we have to understand when the patient comes up, they may be slightly confused. We may have to reorient them, and safety is going to be our #1 priority. Okay, let's take a look at adjunctive therapies. So there's quite a few that are listed, so we'll mention them. And so what is adjunctive therapies? So there's therapies that are used in conjunction with the other treatments that we have mentioned. So we have biofeedback, agitation therapy, play therapy, pet therapy, complementary, and alternative medicine. So let's talk about biofeedback. Biofeedback is a training program used for specific types of anxiety that is designed to develop the client's ability to control their heart rate, muscle tension, and other autoimmune or involuntary functions of the nervous system by using monitoring devices during situations that trigger this reaction. So after this, we follow this with an attempt or feedback that allows the person to reproduce the desired change and control these body functions under the anxiety-producing emotional circumstances. Biofeedback works best if it's used consistently. So again, we will trigger this patient, and then we will allow them to attempt to control these bodily functions when they are really stressed out, and we'll provide them immediate feedback. Agitation therapy may be used in people who display problematic and aggressive behavior and do not respond positively to other therapies. In this form of therapy, and we're talking about agitation therapy, the person is exposed to external agitation from other patients in a controlled atmosphere. This is designed to increase that person's self-awareness of maladaptive behavior limitations. The goals of this therapy, agitation therapy, is to teach sublimation of aggression. So we want to reduce that aggression and anger impulses and give the patient the insight so they have the willingness to change. Play therapy is often used with children and allows the therapist to treat the child during the dynamic process of play. The therapist assesses the child's internal affective state and psychological response during the various stages of treatments, and the activity techniques used, well, the child can express their emotions and feelings. If they're not able to do so in words, they will do it through play therapy. The attachment that is formed between humans and animals helps us to have pet therapy. So animals are very helpful because petting the animal can bring comfort and the comfort of touching the animal, and also acceptance that we get from animals because they love us unconditionally. So additionally, studies have been done to show that there are relaxing benefits, lowering the blood pressure, reductions feeling of stress just with pet therapy. So pet therapy is really amazing. So complementary and alternative medicine, that's your CAM. These include acupuncture, where we will stick needles, and nurses will not do this, but the patient will have needles that will be placed in certain points in their bodies. Herbal remedies, yoga, spirituality, religious activities, and meditation. So again, these are complementary and alternative medicine. Complementary means that we use these kinds of therapies with the medication that the doctor or the psychiatrist prescribes, as well as maybe individual counseling, family counseling, couples counseling. So really important. And of course, creative art therapy, and that allows the patient to tap in to their creative side. They can go ahead and create works of art to help express their feelings. So let's talk about pharmacologic medications and mental illness. So there are different categories of mental health disorders, and that's going to determine the types of medication the patient may be prescribed. So when we talk about the categories of mental illness, we're looking at mood alterations, we're looking at irritability and anxiety, we're looking at altered thought processes, we're looking at misperceptions of the environment, impaired and illogical communication or interaction patterns. We're also looking at disorientation and confusion. So based on, these categories of mental illness, there's going to be categories of medications. These medications used for mental illness are called psychotropic medications. Again, psychotropic medications. So these psychotropic medications fall into 5 major categories. They are anti-anxiety medications, antidepressants, mood stabilizers, antipsychotic medications, anti-Parkinson or anticholinergic medications. So again, those 5 categories are anti-anxiety medications, antidepressant medications, mood stabilizers, antipsychotic medications, and anti-Parkinson or anticholinergic medications. Each medication has a specific chemical compound or a chemical makeup, and they act differently. So what we want to understand is that all of these medications tend to work on neurotransmitters, and neurotransmitters are chemical messengers inside of the body. And it's important that these chemical messengers work as they are designed to, and they work in the presynaptic compartment that's located before the nerve synapse. So again, it's just important to understand that neurotransmitters, chemical messengers, this is what your psychotropic medication is working on these neurotransmitters. So let's take a look at the age-related psychological changes in the older adult. So in the older adult, the half-life of medication tends to increase by as much as 5 to 6 times, increasing the risk of toxicity. The effects accumulate slowly and may not be apparent for days or weeks following the initiation of the medication. So what does this tell me? This tells me that my geriatric patient needs to take the lowest possible dose. As a nurse, I need to watch out for signs of toxicity. I need to look out for signs of adverse reactions or side effects to these medications. So really, your geriatric patient is at great risk. And as a nurse, I need to be able to understand that if a patient is confused, it might be due to the medication. If a patient is showing dementia-related aggression, I need to take a look at that and know the clinical cues. I need to understand how the patient is responding. Again, could be a result of their medication or medication toxicity. So here's some questions. Question number 1, tell whether the following statement is true or false. The nurse's role as an advocate includes protecting the rights of the client. Is that true or false? Pause and answer the question. And it is true. As an advocate, the patient is going to be helped by the nurse, and the nurse works to protect the patient's rights through acceptance and support for their decisions. Okay, question number 2. Which of the following individual therapy focuses on correcting distorted thinking patterns? Is it psychodynamic, humanistic, behavioral, or cognitive behavioral? Take a moment, pause the video, and determine what your answer is. Correct choice is D, cognitive behavioral. It's all in the name, right? Cognitive therapists believe that your clients can change their behavior by changing their distorted thinking about themselves and their experiences. Okay? So D, cognitive behavioral therapy. Last question. A behavioral technique in which the client and the therapist draw up an agreement to which both parties are obligated is called a therapeutic milieu, contracting, electroconvulsive therapy, or biofeedback. Take a moment, pause the video, and determine your answer. The correct answer is B, contracting. So the client and the therapist, they make this contract, and the contract requires the client to demonstrate specific behaviors, and in exchange, the therapist will give certain rewards. The criteria for success are outlined in the contract. At this time, this concludes our discussion of Chapter 4. Remember to be curious, have a questioning attitude, and always think like a nurse. Thank you.